What is rubella? Rubella is a contagious viral disease that is accompanied by skin rashes, red eyes and fever. The infection is called a childhood infection because, as a rule, people first encounter it in kindergartens and schools. Despite the fact that the disease in children is quite mild, vaccination against it is included in the list of mandatory ones. This is because the virus is very dangerous for pregnant women. Infection with rubella in the first trimester often leads to fetal death or serious defects in its development, blindness, deafness, mental retardation or heart defects. Approximately a third of all pregnancies end in miscarriage, and the proportion of congenital anomalies reaches 60%. Transmission routes. How can you get rubella? Rubella is transmitted by airborne droplets. You can become infected through close contact or if a patient sneezes or coughs nearby. The disease is especially contagious in the first 5 days after the rash appears. But the virus can spread for a week before the rash appears. A person may not even suspect that he has rubella and is contagious to others. Therefore, it is important to inform about the diagnosis to everyone who came into contact with a carrier of the virus a week before the first manifestations of the disease. Possible sources of infection. People who are acutely ill. People who are ill in the erased form. Rubella is asymptomatic or with unobvious symptoms in 30 to 50% of cases. Children with congenital rubella. They can shed the virus for 2 to 2.5 years after birth. The rubella virus is sensitive to drying and unstable in the external environment. So it is almost impossible to become infected through shed objects. Stages of development of rubella. The incubation period for rubella is 2 to 3 weeks. At this time, the disease does not manifest itself in any way, and the virus actively multiplies in the lymph nodes. A few days before the rash begins, a person becomes contagious. The rash first appears on the face and then spreads throughout the body. The initial stage is characterized by enlarged lymph nodes, increased temperature, inflammation of the mucous membrane of the nasopharynx and eyes. 1 to 2 days after the rash appears, antibodies begin to be produced that can neutralize the virus, and the symptoms gradually subside. In adults, rubella may be accompanied by pain in the joints. They can last up to 10 days. A person remains contagious for up to 7 days after symptoms disappear. Classification of rubella. Rubella is classified according to its type, severity and nature of complications. Classification of rubella according to the type of manifestation of symptoms. Typical is manifested by a rash, enlarged lymph nodes, and fever. Atypical is mild, symptoms are completely absent or only one of them predominates. Rash, enlarged lymph nodes. Classification according to the severity of the flow. A mild form of rubella occurs without fever and signs of intoxication, such as body aches and headache. There is an increase in the cervical and occipital lymph nodes. The rash is not abundant or may be completely absent. The moderate form of rubella is characterized by a slight increase in body temperature and signs of intoxication, which disappear in 1 to 2 days. The cervical and occipital lymph nodes become enlarged. The rash is not abundant, pronounced. Severe rubella occurs most often in adolescents and adults, accompanied by a sharp increase in body temperature, up to 39 degrees Celsius, which can persist for 2 to 4 days. Signs of intoxication are pronounced and last 3 to 4 days. There is damage to the respiratory tract and enlarged lymph nodes. The rash is abundant and bright. In some cases the formation of papules is possible. Severe rubella often leads to complications. Classification according to the presence of complications. Without complications, with complications, with the addition of a secondary infection, with exacerbation of chronic diseases. Classification according to ICD-10. In the International Classification of Diseases, ICD-10, rubella, German measles, is designated as B06. Rubella with neurological complications, encephalitis, meningitis, meningoencephalitis, is designated as B06.0. Rubella with other complications, arthritis, pneumonia, has the code B06.8. Rubella without complications is designated as B06.9. Rubella symptoms. The severity of clinical manifestations of rubella depends on the severity of the course and the age of the patient. Common signs of rubella. A small red rash that first appears on the face and gradually spreads throughout the body. Redness of the eyes. Slight increase in body temperature. Enlarged lymph nodes. Headache. Clinical manifestations of rubella in children. In uncomplicated rubella, the temperature lasts 1 to 3 days and may be accompanied by signs of intoxication, headache, weakness, pain in muscles and joints. Catarrhal manifestations, redness of the throat and inflammation of the eyes, are mild. A dry cough and nasal congestion may occur. The occipital and cervical lymph nodes become enlarged and may become tender 1 to 3 days before the rash appears and return to normal size a few days after the rash subsides. In some cases, generalized lymphadenopathy develops, that is, enlargement of the lymph nodes in 2 or more non-contiguous areas. The rash appears first on the face, behind the ears, on the scalp, and then spreads throughout the body, affecting the arms, legs and torso. It is most pronounced on the bends of the limbs, on the back, lower back, and buttocks. The rash does not affect the palms and soles of the feet. The rash may be small spotted, 75% of cases, large spotted, 5% of cases, maculopapular, rare. The rash lasts 2 to 3 days and then disappears. About a third of all cases of the disease occur without a rash. Rubella in adults. Rubella is more severe in adolescents and adults than in children. The temperature can rise to 39 degrees Celsius and last up to 4 days. The disease is accompanied by general malaise, symptoms of intoxication, headache, body aches, and inflammation of the conjunctiva. Sometimes there is pain in the joints, which can last up to 10 days. Adults have a higher risk of complications. Complications of rubella. As a rule, rubella is easily tolerated and does not cause complications. In rare cases, the following may develop: inflammation of the joints, arthritis of the fingers, wrists or knees, which lasts for a month after infection, ear infections, otitis media, inflammation of the brain substance, encephalitis. You should consult a doctor if symptoms of infection worsen or new ones are added to them. Severe headache, pain in the neck, ears, visual disturbances appeared. Rubella infection occurred during pregnancy. Rubella during pregnancy. Rubella during pregnancy is extremely dangerous for the fetus. The virus can be transmitted from the mother in utero through the placenta and cause congenital rubella syndrome in the infant. Infection in the first trimester of pregnancy is most dangerous for the fetus. In pregnant women, rubella may be asymptomatic or resemble an acute respiratory disease, accompanied by a slight increase in temperature, redness of the eyes, enlarged lymph nodes and rashes on the skin. For the fetus, Intrauterine infection can result in death or the development of pathologies, including mental retardation, deafness, blindness, heart defects and other internal organs. The consequences of rubella infection for the fetus depend on the period of pregnancy during which the infection occurred. In the first trimester, the risk of developing congenital rubella syndrome is the highest, about 85%. In the second trimester the probability is significantly lower, and in the third trimester it is extremely low.